To the community we serve, I'm pleased to share that UCFS Healthcare, the longest-serving healthcare system in the region, is sound and prepared to meet the needs of our community. I'm Jennifer Granger, President and CEO of UCFS Healthcare. While the presence and demands of a pandemic are undeniable, the headlines that I'll share with you today represent just a few months of a very full year spent working to improve the health and well-being of our community. The sudden and universal impact of the onset of COVID-19 resulted in an equally sudden and universal change in all aspects of our operations. How did we achieve immediate implementation of remote teams, telehealth services, and countless other new protocols? Simply said, we adopted and adapted in fast forward. In just 3 days, we trained over 170 clinicians and launched fully functional telehealth technology that allowed our behavioral health and medical clients to have a timely, supportive, and quality care experience. By reducing barriers to care, we improved access significantly by providing video and telephone telehealth visits and increased adoption of our patient portal for easy communication. Governor Lamont declared a public health emergency that left little doubt about the seriousness of the COVID-19 pandemic. Businesses and schools closed their doors, but essential workers like UCFS remained open. Anyone who needed to be seen face-to-face by a medical, dental, or behavioral health provider could do so safely. In addition, we provided nearly 3,000 COVID-19 tests, both at UCFS and in the community. I'm in awe and forever grateful for our UCFS healthcare heroes. I should point out that this nearly instantaneous shift in how we provide care came directly on the heels of our Epic electronic health record implementation. With over 120 new computers and a fully re-engineered voice and data network, by the first week of March, we were not only prepared for greater client demand, we were prepared for something unexpected. A pandemic. Thank you to the entire information technology team. We couldn't have made it through this year without you. Speaking of being without, the pandemic only magnified the plight of residents going without basic food and saw those numbers grow exponentially. While simultaneously providing free and accessible COVID-19 testing to individuals from 55 towns in eastern Connecticut, we also handed out more than 41,000 pounds of food. In between the pandemic, pantries, and computer programming, we fulfilled our core mission to meet the evolving healthcare needs of our community, bringing much-needed primary care services to our existing New London Health Center and our popular elder care programs. I can think of no greater need than to make access to healthcare safer for our vulnerable seniors. Fast forwarding to the months ahead, what can we expect? Well, for the most part, the unexpected. In addition to unknowns such as when a COVID-19 vaccine will arrive, we do know that we all need to work more aggressively to ensure that people take care of their preventive, chronic, and primary care needs while minimizing the risk of exposure to this virus, because we can't let the fear of getting sick keep us from staying well. Beyond that, we have much to look forward to. A time when we can share smiles, shake hands, hug our loved ones, gently kiss foreheads, and make those connections that are the very heart of our humanity. As much as we wish we could fast forward to that time, we need to remain in the present and face the challenges before us. On behalf of more than 380 health professionals who define our network, I conclude this report with the most important statement of all. Please remember, mask up, numbers down. Thank you. To stay informed about UCFS Healthcare, follow us on social media or visit ucfs.org.